Welcome to Yada Yada Family Medicine. I'm Dr. James. Today I'd like to discuss a very common infliction, heartburn. Heartburn is a symptom of a condition called reflux esophagitis or reflux. Reflux is a condition in which acid goes beyond your stomach and fluxes in a retrograde fashion or up into your esophagus, which can lead to the symptoms of heartburn. The presence of increased acid in the esophagus can cause pain, pressure, a burning sensation in your esophagus or throat, increased burping and gas, and regurgitation of acid or food. Again, it is a very common condition. There could be many causes. Sometimes you can have increased acid production in the stomach, and sometimes certain foods can cause this. And sometimes your lower esophageal sphincter or the muscular band at the end of the esophagus as it enters into the stomach is incompetent and it can't keep the acid where it should be. I'm going to tell you why seeking help for your acid reflux is very important. It's important because number one, heartburn can be very uncomfortable. And number two, it can lead to worse conditions. And number three, the symptoms of heartburn might not be reflux at all. It could be something different entirely, such as esophagus motility issues, lung problems, or heart problems. In any of these cases, it's very important to speak with your doctor to help differentiate the different causes of the symptoms and to come up with the appropriate screening measures and treatments, of which there are many safe and effective options. As I said previously, symptoms of heartburn can be brought on by certain foods, sometimes spicy foods, also citrus, tomato-based products such as spaghetti sauce, pizza sauce, or ketchup, and also even chocolate can increase acid. But caffeine, alcohol, cigarette smoke, nicotine, they can all lead to increased acid and heartburn symptoms as well. So what are the risks? Well, erosive esophagitis and changes in the cells in the lower part of the esophagus can happen, especially with constant and/or untreated reflux. The changes in those cells is called Barrett's esophagus, and it's a risk for developing esophageal cancer. So again, for those reasons, it's important to see your doctor about your heartburn symptoms. What about diagnosis? Diagnosis is typically made by taking a history and physical exam and correlating the typical symptoms. We call this a clinical diagnosis. However, as I said before, there can be more severe cases which need to be diagnosed by a digestive system specialist who can do an endoscopy or EGD with a camera down into your esophagus and into your stomach to look for those cell changes in the esophagus or other problems that may be present. What about treatment? Treatment's usually most effective when directed by your doctor, but there are many products, even over-the-counter products, that are formulated to treat reflux or heartburn. Usually the first line of therapy is lifestyle modification, such as to stop eating the offending foods, quit smoking, limit alcohol and caffeine intake, lose weight, and even elevating the position of your head at night, which can limit the amount of reflux you may experience when you lie down. The medications used to treat reflux are typically H2 blockers, which are histamine-specific blockers, such as cimetidine or famotidine, and proton pump inhibitors, such as omeprazole or esomeprazole. Usually heartburn is intermittent, in which case a 2-week course of an H2 blocker should be sufficient. But again, if symptoms persist and things aren't improving, please don't continue to just self-treat over the counter. You should really see your doctor because there may be an underlying issue that is more severe. Sometimes surgery is also used to stop severe cases of reflux esophagitis. If you are having what you think are symptoms of heartburn, please talk to your doctor. For Yada Yada Family Medicine, I'm Dr. James. Thank you for watching this video. We appreciate when you like and subscribe below so we can help others to stay informed and stay safe.